Hello again. We're here from Miramar, our offices for CCMS, and my name is Mario Espino. I'm the founder and chairman of the board for the company, and I'm here along with Luis del Pozo, one of our patients, one of the followers of the Heat too. You know, a big proponent.
That's right.
You've been with the Heat since they started, right?
1989.
So you're one of the founders of the Heat beginning, and you get in your seats. That you've never let your seats go at any time.
All the time.
How do you feel now after this? At least we got to the playoffs. But how do you feel after this sweep from the Cavaliers?
That was terrible. I think they need to regroup again.
I
really think so.
I do. I hope we're in a building pattern.
And I hope they can make it too.
Yeah, I hope so. I don't know. I saw a couple players that I thought that were really, really good. Matt Strus was one of those guys that I thought was a better three-point shooter and a better defender than, what's the name of the guy, the 55?
You mean Johnson?
Robinson.
Right.
Yeah, Robinson. Luis, thank you, man. Thank you for coming over, spending some time with us here. Tell us a little bit, because I know that you're again another one of these people that have been blessed to grow, to an age and have quality of life. But in that, you have some issues that are health issues, and you've had some scares.
I did.
And in one of those, we were fortunate enough to be there and sort of tag you into the program.
Absolutely.
How did that work out?
Well, I have a couple of sequences. One of them was I got high blood pressure, and I've been thinking all the time whenever I get an episode to go to the hospital. Since I got CCMS, that prevents me from actually going to the hospital, because they take care of me from A to Z in my house. So basically, the help has been there. Not only for that, I also I'm borderline on sugar levels, and my sugar levels sometimes get a little bit higher. They also are being taken care of by CCMS. So I'm extremely grateful for the type of service I'm getting from CCMS.
That's great.
And they visit me often. They come to my house every week. So even if I'm thinking about going to a hospital, that already disappeared from my mind.
Yeah.
And that I owe to your company.
Thank you. That's precisely what we want. We want the people to hear is that that there's moments where everything is good, and then there's moments where things go bad. And in those moments when the things go bad, sometimes you're cautious and you say, well, do I call 911? Do I go to the hospital?
I got an episode in which CCMS helped big time.
Yeah, you called in the middle of the night, I
That's
understand,
right.
and then someone went right over to see
That's
you.
correct.
And it was just maybe it was an emotional thing, or I think it was during a time, if I remember correctly, that your medication wasn't working good, and you would at nighttime you would become your blood pressure was going up very high.
That's
and it
correct.
concerned you, and not because you knew of that, you knew that you'd have no one there. You made a phone call, and then
somebody show up right away, and I got 2 phone calls. I got a third phone call, and about less than an hour, I got someone in my house.
Wow, that's great. I'm
that
glad.
was really good, because it prevents me from even calling 911 or going to a hospital.
Yeah.
And it did the job, because it makes me feel better. My blood pressure drops within the next 15 minutes.
Yeah, sometimes it's
And it went back to
emotional.
normal. And also, I must mention something else. I got a fall in which I got hurt, and weekly, CCMS nurse came to my house and cured me, took care of me on my arm, and it was a weekly thing. I didn't have to go to any doctor. I didn't have to go to any hospital.
Urgent care center. Right.
At all, and it wasn't a matter of minutes before they took care of everything else.
If I remember correctly, at the beginning of that, it was daily that they had to be there, and they were there every day. And was there any out-of-pocket cost for you?
Not one penny.
Not one penny.
No.
Yeah. So
And he was taking care of me like if I was paying $2,000 a minute.
Well, thank God we don't charge that. Thank God we don't charge that at all. Wow, what an incredible life! Spending all that time, with with the heat. And I hear
Very
you're
active. I'm very active.
Yeah, and I heard that you were an executive with the University of Miami as well.
I was a vice president of UM for almost 50 years.
That's great. That's great. Did a lot of great things over there. Brought some doctors in.
Yeah.
I hear before we got into this conversation. That's incredible, Luis. That's incredible. I think that you're the typical person that would need our services, and feels better because the service is there. And then there's the persons that are really sick or maybe more homebound. You have some moments where your blood pressure is really high and you don't feel that well. But then we have those patients that are really, sort of homebound, and they're at home and they have less opportunities than you do to move around. And that's where we can really make a difference, and that's where the company really excels. And that's where I can tell you that we're saving lives every day. Every day we're saving lives here, because what we do, nobody's doing out there. Nobody's going to physically into those patients' homes that need their help and seeing them there. And what we see while we're there is what makes the big difference. And it's not the case with Mr. Luis Del Pozo, but it is the case with many others. Food, they need some food, or they may not be able to get their medications, or they may not be able to manage their medications. Yes. It could be a host of things. Not your case, Luis, but those patients are the people that really could, it could be a life changer for them, because an instance that you have a moment of decompensation, it can happen to anybody, and we track them here between the ages of 65 and 70, 70, 75, 75 to 80, and then 80, 85 and plus. And every one of those diseases, as the time goes on, gets a little bit more sensitive, But what we do with those patients and monitoring them, it allows them to not go to the hospital. And when they go to the hospital,
Mario, also, it takes the worry away from the elderly people.
Yeah.
When you're so worried about, I'm alone, I'm getting sick, who is going to take care of me? Do I go to the hospital? It will stop me from thinking about it.
I know I'm not there yet. I'm not there yet, but we all get there. I know it's a dark hole. It has to be, when you don't have anybody else, and you're sitting there and you're seeing yourself, your blood pressure, or you're feeling bad,
Right.
and it becomes emotional as well, and it could make things worse,
Right.
It could make things worse. Yeah, I think that the support, that we provide all of our patients at home with diseases, those chronic diseases, they're not meant to be managed in the hospital. The hospitals are for acute care situations, surgeries, other things, God forbid a heart attack or a CVA, something like that. But the management of these chronic diseases, which can and will decompensate from time to time for different reasons, sometimes emotional, just like Luis was saying right now, is the way those are the things that we can resolve, and backfill those areas where the patient may not be able to put their
Right.
15 or 20
Right.
medications and sort them out between
Right.
morning and afternoon.
Right.
So, and sometimes they did I take it? Did I take it? So, anyways, Luis, anything else that sort of that tells you, or that you can tell one of the people that are listening to us now, that makes a difference between, care at home versus having to go to try to get care somewhere?
Well, when they go, most of the time when you go to take care in the hospital environment, or even in a doctor's office as well, you have to wait hours to be taken care of.
Yeah.
And whether you're right or wrong, whether you feel right or wrong yourself, you yourself think that you need to go to a hospital. You might not need any of that. Preventive medicine is what you're providing. So if you're providing this type of medicine, and you prevent me from thinking about going to a hospital, I welcome that 100% all the time.
Thank you so much. I do believe that that's where we can make a big difference, and getting out in front of the disease. I thank the government for allowing us to do what we do, to expand the services. And we had to, I don't know if you know this or not, Luis, but we spent a number of years without getting any reimbursement, but we believed, my wife and I believed so much in the business that we were doing, because I come back from a background that is with Centers for Medicare and Medicaid Innovations, which is like an innovative spot for things that you want to do later on. So I believe so much in the idea, in this idea, and I was there were so many things that made a difference. There were so many touch points that were important. That I always say, careful what you ask for, because they all come to you at one time.
That's true.
How do you organize them to say, well, which are the ones that are the most important? And you've been able to work through those things, and today I think that we have a good grip. We're saving lives every week, every day. From people like yourself or others that are more homebound. But we enjoy this immensely, man. Thank you so much for coming.
Welcome.
Really appreciate
If the action that you and your wife have put in doing all this work and the government help you with it, God bless you, because it's helping big time.
We find just precisely what you said. Whenever we're able to speak about the services clearly, there's anybody that's in the healthcare field says, "Thank you guys, thank you for doing what you're doing." It's almost
I'm
like
extremely grateful.
It's thank you so much for saying it. It's never not enough to hear. And it has been tough getting here. Getting all these things ironed out, because I'm not satisfied ever with where we're at. I want to do more and save more and get better results and better quality of life for our patients. So yes, it's for you, or it may be someone that that needs our services. Don't forget, call CCMS 877-212-2267. Call us. We have a solution for you and your family member, friend that needs services at home, or that would be better being served by a medical service that goes to their home. Thanks again, Luis.
Thank you. Thank you for your service.
All right.
And go Heat.
Go Heat. Yes, go Heat.